Hello, my name is Kimberly Atkinson, and the purpose of my study was to explore mindfulness-based interventions for middle school students diagnosed with attention deficit hyperactivity disorder, or ADHD. ADHD is one of the most prevalent disorder diagnosed in children and adolescents in the United States. And in 2016, a study estimated 5.4 million children between the ages of 2 and 17 had a diagnosis of ADHD. The diagnostic criteria includes inattention, impulsivity, and/or hyperactivity experienced in multiple settings, resulting in functional impairment. Stimulant medication is currently the primary treatment option, despite guidance from the American Academy of Pediatricians that recommends behavior treatment as the first line of treatment for preschool students and combination therapy for older children and adolescents. In the last few decades, there's been a lot of research that's shown mindfulness interventions to be effective in treating symptoms of depression, anxiety, stress, PTSD, substance misuse, and chronic pain. And in recent years, there are emerging studies that are exploring treatment for ADHD, and a meta-analysis of these studies suggested exploration of appropriate techniques for different developmental stages, especially in children and adolescents. The purpose for my study is to explore two different mindfulness-based interventions, mindfulness-based cognitive therapy and the Mindfulness in Schools program. The mindfulness, and we were going to recruit participants from two local middle schools and do one in one school and one in the other. The mindfulness-based cognitive therapy would be administered by two therapists that are trained in MBCT, and they would consist of 8 90-minute weekly sessions, parallel sessions with both parents and the students. The Mindfulness in Schools program consists of 10 weekly 20-minute sessions that would be administered in the classroom by teachers to the students. The hypothesis of my study is that the symptoms of inattention, hyperactivity, and impulsivity, and parent-peer relations will improve with both interventions, with a more substantial improvement with the more intensive mindfulness-based cognitive therapy. And my null hypothesis is that there would be no improvement in symptoms of ADHD. For measurement, we would use the Connors 3 short forms for a parent, teacher, and students, and it consists of 41 to 46 items that are Likert type scale and would result in interval scales to be measured for statistical analysis. My study is quasi-experimental between groups design, and my participants will be 15 to 20 students in each group recruited from the two local middle schools. Inclusion and exclusion criteria is that the children have a clinical diagnosis of ADHD and they have no comorbid disorders, a minimum IQ of 80, be aged 11 to 13, and will be both male and female. The statistical analysis will be performed on the Connors 3 results that will be administered pre-intervention, post-intervention, and at 6 weeks follow-up. And we will have independent group t-tests to compare the means of the different groups to determine if one intervention is more effective than the other. And this is a summary of my research proposal, and I thank you for listening and wish you all a very Merry Christmas.